Pink eye is really, really frustrating, but can you treat it at home? Hi, I'm Dr. Nagori. I'm a board certified ophthalmologist, and today we're going to talk about why treating pink eye at home is going to be largely useless. So first of all, what is pink eye? Pink eye is another name for conjunctivitis. The conjunctiva is a thin layer of tissue that covers the surface of your eye. When it becomes inflamed or infected, we call it conjunctivitis. Now, conjunctivitis can happen for a number of different reasons. Sometimes you can have allergic conjunctivitis from eye allergies, viral conjunctivitis from a virus, or bacterial conjunctivitis from a bacterial infection. Now, in the case of allergic conjunctivitis, over-the-counter allergy medications can be pretty effective, as can over-the-counter allergy eye drops. But when we are talking about pink eye, most patients are referring to viral conjunctivitis. And viral conjunctivitis is very different from allergic conjunctivitis. There's actually another video on the channel that discusses the difference between the two, so if you're curious, you can check that out. Now, viral conjunctivitis, as the name suggests, is caused by a virus. So in patients who have viral conjunctivitis or pink eye from viral conjunctivitis, they may have other symptoms also, like a runny nose, or they may have recently had a cold. Also, if pink eye is going around in your child's school, or you've come in contact with someone with pink eye, and then now your eye becomes pink, it's more likely that it's going to be pink eye from viral conjunctivitis than a red eye from something else. So now, why are at-home treatments for pink eye largely useless, as I mentioned before? Well, the thing is, with pink eye, because it's a virus, we generally need to let it just run its course, and its course can be pretty long, sometimes 2 to 3 weeks. And while there's really no at-home treatment for pink eye, and your eye doctor is not really going to prescribe you an antiviral for the pink eye, there are at-home treatments for the symptoms of pink eye. And what this means is it might help you feel better or help your child feel better, but it's not necessarily going to speed up the resolution of the process. In the case of bacterial pink eye, you will definitely need a doctor to prescribe you antibiotics, because the bacteria will not go away unless it's treated with antibiotics. So that is really important for the resolution of bacterial conjunctivitis. However, the vast majority of pink eye cases that we see in the community are from viral conjunctivitis. And because viral conjunctivitis is so contagious, we start to see it come in batches. So if you start to see one patient with pink eye, it just so happens that during that week, you'll see many more patients with pink eye because it just seems to be going around in the community. So even though there's no real treatment per se that can cure the viral conjunctivitis, it's still important to check in with your eye doctor to make sure that it's not bacterial conjunctivitis or not allergic conjunctivitis, because both of those have pretty effective treatments. So if you do have viral conjunctivitis and you've made your appointment with your eye doctor, what can you do in the meantime at home to make yourself or your loved one feel better? The first step is going to be keeping that area clean. So make sure you're using a moist towel or tissue to wipe away any of the mucus so that your eyelids are not stuck together. Sometimes cool compresses can also be very helpful to alleviate any discomfort in the eye. And finally, artificial tears are also usually very helpful to just soothe the eye from the inflammation that's going on from the pink eye itself. Another at-home tip that's actually really, really important is frequent hand washing. Because viral conjunctivitis is so contagious, if one person in your family gets it, it's pretty likely that other children in your family are going to get it, and you may also get it as well. So you want to avoid sharing bed sheets or pillow covers and wash those frequently. And again, just frequent hand washing to avoid the risk of transmission to another person. So unfortunately, when it comes to at-home treatment for viral pink eye, there really is no treatment or cure for viral pink eye. You really do need to just sort of wait out the course of the disease. And usually that'll take about 2 to 3 weeks. It is important to check in with your eye doctor, not just to distinguish it from other causes of pink eye or a red eye, but also because in the cases of viral conjunctivitis, you can get problems afterwards in the cornea, which do need to be treated with medications like steroids. So your eye doctor will need to check you for that in person using the microscope. Hope you found this helpful. Remember to subscribe below, and I'll see you in the next video.